What tests are used to diagnose joint degeneration? If you have been experiencing joint pain or stiffness, you may be wondering how doctors figure out what is going on. Diagnosing joint degeneration, especially in the context of arthritis, involves several key tests. Let's break down what healthcare providers typically do to assess your condition. First, a healthcare provider will conduct a physical examination. During this exam, they will check for tenderness, swelling, and flexibility in your joints. They will also assess your range of motion. This initial step is crucial for identifying which joints are affected and how severe your symptoms are. Next, imaging tests play a significant role in the diagnosis. X-rays are the most common imaging method used. While X-rays do not show cartilage directly, they can indicate loss of cartilage by revealing narrowing spaces between bones in the joint. X-rays can also show bone spurs and changes in bone shape that occur with degeneration. However, it is important to note that early joint damage may not be visible on X-rays. If the diagnosis is unclear or if there is suspicion of soft tissue damage, magnetic resonance imaging is often used. This imaging technique provides detailed pictures of both bone and soft tissues, including cartilage, ligaments, and tendons. While not always necessary, magnetic resonance imaging can give a more comprehensive view of joint structures. Another imaging option is a computed tomography scan. This test combines X-rays and computer technology to create detailed cross-sectional images. Although less commonly used, it can be helpful in complex cases to visualize both bone and soft tissues more clearly. In some cases, a bone scan may be performed. This test involves injecting a small amount of radioactive dye into the body. A scan is then done to look for increased bone activity, which may indicate inflammation, infection, or fractures. Laboratory tests also play a role in diagnosing joint degeneration. While there is no blood test that directly diagnoses osteoarthritis, blood tests can help rule out other types of arthritis. For example, tests like the rheumatoid factor and anticyclic citrullinated peptide antibody can help detect rheumatoid arthritis. The anti-nuclear antibody test screens for autoimmune diseases such as lupus. Additionally, tests measuring C-reactive protein and erythrocyte sedimentation rate assess inflammation levels in the body. Another important test is joint fluid analysis. In this procedure, a healthcare provider may draw fluid from the affected joint using a needle. This fluid is then examined to rule out infections, gout, or inflammatory arthritis, which can mimic degenerative joint disease. In summary, diagnosing joint degeneration involves a combination of physical assessments, imaging studies, and laboratory tests to exclude other causes of joint symptoms. This thorough approach helps ensure an accurate diagnosis and guides appropriate treatment options for arthritis-related joint degeneration.